When the heart is injured with ischemic stress, as in a myocardial infarction or heart attack, there's a lack of oxygen because the blood flow is inhibited. Part of the heart dies, essentially. Most people develop congestive heart failure because of that area of the heart is not regenerated. Heart failure is the number one cause of death.
The goals of the research that we're doing are designed to improve the structure and the function of the heart after an adverse event like a myocardial infarction, so the patients can have a better quality of life. We're working on a cell-based therapy that we believe can modify the wound healing process. We are trying to develop a treatment that can help their heart heal from the damage that was induced by the myocardial infarction.
We're using gene therapy to make existing heart cells that survive after a heart attack stronger. We're trying to use viruses to carry genetic cargo into the heart to make the muscle stronger. And it's quite possible that we could be in clinical trials in the next 2 to 3 years. We think we can offer them hope and to increase their lifespan.
I think we could have a major impact on patient care moving forward.